This skin care lotion is used to moisturize and treat dry, rough, scaly, itchy skin, as well as minor skin irritations such as diaper rash and skin burns from radiation therapy. Emollients are ingredients that soften and moisturize the skin, reducing itching and flaking. Some products are specifically used to protect the skin from irritation, such as wetness. Dry skin occurs when the upper layer of the skin loses water. Emollients/moisturizers work by forming an oily layer on the skin that traps water. Common emollients include petrolatum, lanolin, mineral oil, and dimethicone. Humectants like glycerin, lecithin, and propylene glycol draw water into the outer layer of skin. Many products also contain ingredients that soften the top layer of skin cells, helping dead skin cells fall off and leaving the skin feeling smoother and softer. Make sure to use this product as directed, and some products may require priming before use. Follow the directions on the product package, and if you have any questions, ask your doctor or pharmacist. Some products may need to be shaken before use, so be sure to check the label to see if you should shake the bottle well before using. Apply the lotion to the affected areas of the skin as needed or as directed on the label or by your doctor. The frequency of application will depend on the product and your skin condition. For dry hands, you may need to use the lotion every time you wash your hands throughout the day. If you're using this product to help treat diaper rash, make sure to clean the diaper area well before use and allow it to dry before applying the lotion. For radiation skin burns, check with radiation personnel to see if your brand can be applied before radiation therapy. Follow all the directions on the label for proper use, and apply to the skin only. Avoid sensitive areas such as your eyes, inside your mouth/nose, and the vaginal/groin area unless directed otherwise by the label or your doctor. Be sure to check the label for directions about any areas or types of skin where you should not apply the product and consult your doctor or pharmacist for more details. Use this lotion regularly to get the most benefit from it. Most moisturizers need water to work well, so apply the product after bathing/showering while the skin is still damp. For very dry skin, your doctor may instruct you to soak the area before using the lotion. Long, hot, or frequent bathing/washing can worsen dry skin. If your condition lasts or gets worse, or if you think you may have a serious medical problem, make sure to get medical help right away. Emollients like advanced skin care lotion are generally safe with no side effects, but some people may experience burning, stinging, redness, or irritation. If these effects persist or worsen, consult your doctor or pharmacist. If your doctor has prescribed this lotion, it means they have determined that the benefits outweigh the potential risks. Most people using this lotion do not experience serious side effects, but you should seek medical attention if you notice unusual changes in your skin or signs of infection. While severe allergic reactions are rare, seek immediate medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so consult your doctor or pharmacist if you notice any other effects. In the U.S., call your doctor for medical advice about side effects or report them to the FDA. In Canada, contact your doctor or report side effects to Health Canada. Before using this product, make sure to check in with your doctor or pharmacist if you have any allergies or if you have any skin cuts, infections, or sores. Some ingredients in the lotion may make your skin more sensitive to the sun, so be sure to read the label for any warnings and take special precautions when outdoors. If you have acne-prone skin, look for the word non-comedogenic on the label to avoid worsening breakouts. Also, some products may stain or discolor clothing, so it's important to ask your doctor or pharmacist for more details. If you are pregnant or breastfeeding, it's important to consult your doctor before using this product. And before any surgery, be sure to inform your doctor about all the products you are using. When using advanced skin care lotion, it is important to be aware of potential drug interactions. These interactions can impact how your medications work and may increase your risk of experiencing serious side effects. It is essential to keep a comprehensive list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It is crucial to follow your doctor's guidance and not make any changes to the dosage of your medications without their approval. If someone accidentally swallows this lotion, it can be harmful. If they have serious symptoms like passing out or trouble breathing, call 911 or go to the nearest emergency room. Otherwise, contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center for help. When it comes to preventing dry skin, there are several things you can do. Try using lukewarm water instead of hot water when you bathe, and consider taking baths or showers less frequently, like every 1 to 2 days. Keep your baths or showers short, and if the air is very dry, using a humidifier can help. There are different types of emollient products available, including oils, creams, lotions, and sprays. Some may contain fragrance or other ingredients that could irritate your skin, so it's important to consult with your doctor or pharmacist to find the best product for you. If you forget to use this lotion on your regular schedule, just apply it as soon as you remember. However, avoid using more than directed or using it more frequently to make up for the missed dose. Be sure to check the storage information printed on the package. If you have any questions about storage, ask your pharmacist. Keep all medications away from children and pets. Avoid storing the foam canister near high heat or an open flame, as it is under pressure. Do not puncture or burn the canister. Do not dispose of medications in the toilet or drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.